and welcome to the CARE Crisis and Recovery Enhancement TA Center. Today's presentation on family-centered practices through a crisis lens. We're thrilled for you to join us with our esteemed colleagues, Ebony Chambers and Christina Cagle from Stanford Sierra Youth and Families, one of the partner agencies for the CARE TA Center. We are funded by the California Department of Healthcare Services, the Mental Health Services Act. CARE is led by the CARS, Center for Applied Research Solutions. What we're about to share here today does not necessarily represent the opinions of our funders or CARS. So what is the CARE TA Center? We are funded, as I mentioned, through MHSA to provide training and technical assistance to the MHSA-funded counties and cities across the state of California, specifically regarding crisis continuum of care and justice diversion. We are striving to support people who are experiencing mental health crises in community, such as suicide, overdose, when there's violence in families. Our goal is to try and help provide support to people in the community as much as possible so they can stay out of institutions like psychiatric hospitals, jails, and prisons. Unless there's a medical or other need to actually be in those places, we know that from evidence-based practice and research, when we address mental health challenges and crises, behavioral health crises in the community, it's better for folks. People tend to recover faster, and it is more cost-effective for the state. Next slide, please. So our team, we're really fortunate to work with a collaborative based on 5 agencies. I've already introduced us, the CARS, Center for Applied Research Solutions. We also work with the Recovery International, NAMI, the National Association of Mental Illness California chapter, C4 Innovations, Research and Action Center at Impact Justice, and our esteemed colleagues from Stanford Sierra Youth and Families, of whom you have the benefit of learning from both Christina and Ebony today. Next slide, please. We provide a variety of services to the field. In the pandemic world, of course, the virtual learning events like the event that you're attending today are very frequent offerings that we provide to the field. We also have an upcoming conference, June 16th and 17th. Please mark your calendars. Our theme this year is going to be on diversity, equity, inclusion, and anti-racism with the crisis continuum of care and justice diversion. On our website, we have a variety of resources like a resource library, as well as a new fancy asset map where you can find the crisis continuum of care and justice diversion services in your county. We hope that you'll join us by connecting with our newsletter. We send a newsletter on a quarterly basis, and we provide individual and intensive training and technical assistance. So please do go to our website and submit a request. You might end up being paired with some of our lovely colleagues like Ebony and Christina, who are experts in the field around foster care systems. Next slide, please. And without further ado, we are going to move into our presentation for today. I am going to invite our colleagues, Christina and Ebony, to introduce themselves to you. But what I will say first and foremost is that they really are experts and thought leaders in the field. And we've worked with both of them in a variety of care offerings to date. And we have found them to be exceptionally knowledgeable folks, as well as really engaging educators. So we are excited that they are here with us today. Ebony and Christina.
Thank you so much, Eliana. Hello, everyone, and welcome. We are excited to talk with you all today about family-centered practices through a crisis lens. As we know, this is so critical for us to be able to engage those that are in crisis in a very family-driven and person-centered, care-centered way. And so we'll be talking about some of the aspects of that. How do we do it? And hopefully have a thoughtful dialogue with you all. So we're going to introduce ourselves and share a little bit about ourselves. And I know for those that are just joining in, we are putting our name and our county in the chat. But if you also don't mind going back into the chat and sharing a little bit about your role in the system of care. And if you touch any systems of crisis or work with any families that are in crisis, we'd love to, without sharing any details, just know what kind of part you play in that kind of response. That'll help us, especially as if you have any questions along the way, feel free to use the chat to do that, we really want this to be not just a presentation, but a dialogue for learning. So my name is Ebony Chambers. I'm Chief Family and Youth Partnership Officer at Stanford Sierra Youth and Families. I've been with the organization for about 16 years and worked in a number of different programs within the organization. But at my heart, I am a parent partner with lived experience. I'm a mom of 4 and my oldest adopted. She's now 28, but we navigated multiple systems with her. And one of the things that I saw most needed was a family-driven approach, one that honored my voice, my choice. And when we were experiencing crisis, we needed one that was culturally responsive, collaborative, and we'll talk about some of the aspects of why that's so important today. And so I'll share some of my own experiences as we are talking with you all. And again, excited to be here. I'm gonna pass it over to Christina.
My name is Christina Cagle. I'm the Director of Family Youth Partnership at Stanford Sierra Youth and Families, and I have been at the organization for about 14 years, so long-standing. And most of my experience has been working in the foster care world. And when our oldest son joined our family, that really were a different shift happened to me, and I've always been a family partner in some ways, just because of my lived experience of growing up and then actually taking in our oldest child, which really propelled me into doing more of this direct work of being more of a family partner and advocate. And while I have that lived experience, I can tell you that our kiddo had a really challenging time and we touched different systems. And it would have been great to be approached with a family-centered lens. As my kid may have been more receptive, our family may have been more open to having our voices honored and respected as we were advocating through different channels.
Our learning objectives today is to really talk about what is the philosophy of family-centered practice principles. So we'll go over those principles with you today. There are 10. What does strength-based approach look like when we're engaging families in crisis? And then how do we create a family-centered agency culture along the crisis of continuum of care? Before we get started, I think it's always important to provide the context of how we define crisis. And you'll see a number of different definitions here. We know that at least from our organizational standpoint, we support families in all of these different ways that it's defined below. But just to highlight a few, really an emotionally significant event or radical change of status in a person's life. They have midlife crisis here, but we know that the families that we're working with are oftentimes experiencing crisis related to their mental health and well-being. And that could be also related to cultural trauma that they're experiencing in the community, and a number of other things that might come at them in relation to their family dynamics, work dynamics that causes that. And then another one, an unstable or crucial time or state of affairs in which a decisive change is impending, especially one with a distinct possibility of a highly desirable outcome. So even just thinking about families that are potentially living in constant anxiety, I know for myself, just recently with the murder of the man last week at the hands of law enforcement in Minneapolis, that caused distress in myself in regards to how I would be able to safely navigate the community and how my children could safely navigate the community. So when I talk about cultural trauma, that's an example of one that could set folks in crisis. And so it's important for us to acknowledge that, especially as we're working to be more trauma informed and more culturally responsive to our communities, that those also have huge impacts on our well-being. And so here is a list of different types of crisis response, or different types of crisis that folks can experience. And just to name a few, especially over this last year, COVID, I already named one in regards to cultural trauma, domestic violence, those that are experiencing a mental health crisis, substance abuse crisis. Even more so in California, we've seen, and I'm sure across the United States, we've absolutely seen a rise in those at risk of being unhomed or currently without a home, and really looking as an organization of how do we respond better and ensure that we can prevent it if at all possible. And so working with our communities and being collaborative, which is one of the principles of family-driven care. So we'll talk a bit more about that as well. Families experiencing loss, either grieving loss, or the loss of relationships. There's so many different characteristics of how folks can define crisis. And I think one of the things that's most important as we look at this list is that it's not exhaustive. This is just a few examples. And we know that how someone defines crisis is very personal. And so we approach that without judgment. What may be a crisis for me may not be a crisis for Christina, and vice versa. And so how that's defined and how our community defines it, we meet them where they're at when that's occurring. So here are the different crisis responses that can happen in our communities. One that's missing off of here is 911 and law enforcement. That's something that we did not have on here, but I definitely want to acknowledge that we know that they are a part of that crisis response continuum. But we want to highlight a few as what we would hope to be used first and as an alternative to that, so that we can hopefully have a more family-centered approach to that crisis response. And so just in looking at the chat and seeing who's here, we've definitely got some peer specialists here. We actually have a program coordinator, welcome Donna, who joined the FERS response team in March. And so that FERS is the Family Urgent Response System, which is a system designed to respond better to youth in care and their family members when they're experiencing crisis or even at risk of crisis. And they can call this FERS response system versus calling 911 and receive phone support and potentially even in-person support when they're in those critical stages. And so that's one. I saw the peers on the line, and so great to have the folks that are peer specialists here. There are peer respite programs, but also there also can be peers that are a part of mobile crisis units. And so that's another way that folks can respond in crisis. Yes, a great mix of folks in the room. So very excited to have you all here. And then brief psychiatric stabilization units are another one. Usually those are county driven, but we also have some even within Sacramento County that are county funded, but community driven in the sense that they're very home-like spaces that help to stabilize and support families and youth and adults that are in crisis. Through our organization, we utilize on-call services. So while we have an array of services that we offer at Stanford Sierra Youth and Families, after hours, if anyone is in crisis, they're able to have that on-call service, and we will answer the call and then, if needed, go out and respond to the families in person. And so we are going to talk about how family-centered practice is at the center of all of these resources and service shifts, especially as we're looking to really ground ourselves in finding alternatives to calling 911 and making sure that when we are responding, it has these characteristics. And so just really quickly to highlight them, we've got strength-based, family participation, so that family voice and choice is something that's really important. Connecting families to community, really looking to make sure that we're getting the outcome that they want and desire, so that the services we're providing are actually outcome driven, that it's individualized, the supports are individualized, so we're not using any cookie cutter approaches, it's culturally responsive, and then of course needs driven, and we're operating with unconditional care and regard. And so with that, I'm going to pass it over to Christina to start breaking some of this down for us.
So the first slide we're always going to start off with is when we're looking at family-centered practices, is what is family? As we know, with multiple different views and perspectives in our world, in our communities, that family can look different. And while we may be supporting a family in a crisis that doesn't necessarily align with what we understand family to be, it's important that every time we walk into a situation, we're keeping this in mind and asking questions, seeking to understand that family and who's a part of that family, so that when we are responding to the crisis, we are responding to everyone who needs the support in the moment. And so if you look at this list, it has a whole array of different perspectives and how it may look for a family, right? Lives under one roof. That is probably more common these days, where you have multiple generations under one roof. Endures changes over time, right? A culture unto itself and unique values. So that's family. Some folks have chosen family. We hear a lot about that these days, especially when maybe you don't have shared values of how you were raised because you identify different. And I just think about my peers and colleagues and friends, right, of the LGBTQ community that have shared family or picked family, and they're really strongholds and important people in their lives. And we just need to honor and respect whatever that may look like for any family.
Yeah, I agree with that. And I think there's a lot of definitions here. And again, this is not an exhaustive list either. And one of the things that we've definitely learned is while we can start with this list of definitions, it's important, especially as we're considering natural supports, because that's a huge part of response is understanding who their support system is. And that's why we want to define family. And ultimately, it's who they decide is family. There's lots of definitions, but ultimately who they decide is family. I always say I've got lots of aunts and uncles that I'm not biologically related to, and people call them play uncles and play aunts, but I call them my aunts and my uncles because they are my family, and that's that. And there is nobody who can tell me any different. And the same for my nieces and nephews that I have that now call me aunt. And so, that is important to define for them.
All right, we're going to go into the 10 principles of family-centered practice. And they were listed for you earlier by Ebony. Here's the list, and we're going to dig in deeper. And as you can even see, when we're talking about just even the definition of family and how folks identify family, right? We talked about even strength-based, we talked about natural supports, we talked about culturally competent. And so we're going to look at those in a deeper way. So the first principle that we're going to look at is strength-based. And so anytime we are entering a family situation, always coming from the perspective of a strength-based thought process lens is going to be helpful, and it's inclusive to families. A lot of times families can't even see their own strengths. And when we can help us identify and see the strengths of the families that we're responding to, we're empowering them to really walk the walk and what feels good for them. And so we want to use their strengths to solve these challenges. If you look at Capture the Families and Client Strengths and Assessment, these are just a list of assessments that we use at Stanford Sierra Youth and Families. Your assessments of where you work may be different. If you don't have a strength assessment, it's a good time now to maybe find what tools you are using and how they can be tweaked to ask the question of what is going well. Identifying those strengths for families. It's also a great propeller to help families in healing if we can help them identify where they are successful and some of the great things they bring to the table.
Yeah, I agree. And, even speaking from my own lived experience, when we were navigating services and were even managing crisis, and someone said, what are the strengths? What strengths do you bring? Or what strengths do your daughter have? I was really stuck. I felt like I didn't have any strengths because I just felt really hopeless. And I felt like I was not able to adequately support my daughter in the way that she needed to. And so I think one of the things that we can really do as service providers, as responders in crisis, is really help our communities, help the individuals identify some of the crises. Sometimes it's like you called for help right? You called for help, and that is a strength. And they need to hear that, because it really does help them to start to take a deep breath and breathe, and see that they are showing up and trying to figure out how to best either serve their family member or how to best support themselves when they're experiencing those crises.
So this is a little bit of what Ebony just said, right? Using those active listening and reflective responses. I'm so glad you called for help. Acknowledging, one, the vulnerability, and that's a strength, despite what sometimes messages can be mainstream or in cultures, right? But being vulnerable, asking for help, what a great way for a family to advocate for what they need. We want to acknowledge the courage and the environment that we're walking into, and obviously, not using blaming or judgment language. That's always important, especially to keep conversations going, to make sure that the space remains open for continued crisis support. But this is what we want to focus on when we're looking at the utilization in a crisis: active listening, reflecting, acknowledging, and using non-judgmental language.
Right. And there are ways, even as you're responding and looking at their environment and acknowledging the space, right? If it's safe, or even just acknowledging something, if you're responding to a home environment, acknowledging something on the wall that's, and oh wow, what a beautiful family photo, are ways to help ground someone in a crisis, but then acknowledge something that helps them to ground them. And sometimes that environment helps to do that as well.
I will have to say, though, you have to be mindful about when you're sharing this. So obviously, if everyone is in a very heightened stress situation, you don't want to about face and go, this is a really great painting, because that may not be the time.
That's right.
But when things come down a little bit, or when there's a natural opening, you definitely want to use that approach.
Absolutely.
The next is outcome-based. Outcome-based is pivotal to know if we are working, if the response we're having is working. So checking on our outcomes, making sure that the intention of the program is actually doing what we had hoped for and intended, so that if we need to make tweaks or changes or think about how to respond more appropriately, always looking at our outcomes is important. So, this is where you can continue to do research, continue to make sure we're being innovative. Also making sure we're sharing the information of whatever our assessment or survey process looks like with families, to see if, maybe we're missing something. At our organization, we have parent and youth panels, and we have a shared leadership group of families who have received services from our organization, and it's a direct way we can get feedback on how we're doing and responding and offering our services. And it has been pivotal in making sure that we're really staying true to family-centered practices and honoring the voice and choice of our families. And so making sure, when you're looking at outcome-based as a principal, how are you doing that now? If you're in a crisis response team, I would think about that. And if there are different ways that you can do it, SurveyMonkey is great. They have these great text surveys that you can always use as well. Sometimes it's calling, the week after or 2 weeks after, but there are tools that can be utilized to make sure you're checking on the implementation of your program, the evaluation of that. And you may have already things set up. So consider different tools, and consider really trying to capture those that you've provided support to.
Yeah, and I think one of the best ways, and this goes back to being culturally responsive, is eliciting feedback from those that we're serving. Right, that we are supporting them, and then they are helping to inform better systems by providing us with feedback on how well we did. And so after every on-call call that is made within Stanford Sierra Youth and Families, one of our peer staff, one of our peer specialists, peer partners, calls the family after the crisis event and just ask, how did it go for you? Was there anything we could have done differently? And then we also take the time to do some resource linkage, because at the moment in crisis, when we're responding, we recognize that sometimes it's not a good time to try to flood them with resources. They're already just trying to manage in that moment. And so the next day is often, and sometimes it's not the next day. Sometimes we call and they say, not today, not right now. And we will call them, we say, when's a good time to call back? And so we wait a couple of days to check in with them, get their feedback, but also make sure that we're linking them to other resources in the community. And that's really important for us to get that feedback. It helps to inform the outcomes, but it also lets us know how we can improve our practices.
All right, so here's just a couple of different ways we can capture outcome-based information: satisfaction surveys, on-call follow-up, utilization reports, effectiveness of service. Did we help? That's all the things that Ebony had just mentioned. These are just a couple of ways that we can capture that information.
Right, and utilization reports really speaks to, are they utilizing the services? Are they calling? If you've got, do they feel comfortable calling? And that's the thing to look at when you're looking at outcomes is how many people are already accessing it? Do they have the access? Is there trouble accessing it? We actually had to shift our on-call services because we had a service where they first initially talked with someone else that was not from our organization, and then it was fielded out to the community. And what we saw was from our satisfaction surveys was having that additional person created a barrier to feeling like they were heard and understood in that crisis. And so we removed that barrier because of that, because we saw utilization actually go lower, because once families understood, I'm not going to get the support I really feel like I should be able to receive, I decided I wasn't going to use it. So utilization reports are really important to help inform our practice so that we know if we're meeting the mark. What did we intend to do, and have we set out to do that? And our community helps us to understand that.
So here it is. This is really foundation to family-centered practices. While it is a principle, it is probably one important one, and that is family voice and choice. So if the family is our primary focus, they are the reason why we're responding. And we want to make sure we're really listening to what they are saying in a crisis situation, so that we can make sure we're advocating for them as sometimes other service or other system partners get involved. And it's really like after the crisis, right, when additional support needs to come on, that we need to be checking in and asking our families with how they would like that to look so that we can continue to advocate and support them. We want to definitely involve our family partners or youth advocates if that's a possibility. So if there is a crisis response unit that employs peer specialists and advocates and peer partners, what a great way to really create connection, create just the heart of the matter in a way that like someone who has lived experience to say, like, I get this is what I've been through, and to make sure that those individuals are continuing to advocate for themselves as they take on next steps too. So we want to ask family what they want to address. That's important. Like, these are all important questions. Anytime we are making decisions, we should be asking the family if they are okay with that.
Yeah, agreed. And when we're thinking about even safety planning, and this goes back to being really responsive, what are we asking of them? And when we say what do they want in the plan? Are we just putting into the plan what we think they want, or are we really considering what they're voicing to us? And so it's great to see the peer specialists on the call, because oftentimes they can be a bridge to that, and really sit down with individuals and share from their own lived experience. I know what it was like when I received my plan, and really going through it and thinking it didn't reflect some of the things that I had requested in there. Does this plan reflect your needs? And so that's just one way that you can elicit elicit that family voice and choice is by way of honoring the voices of the lived experience staff that you have within your organization. But if you don't have that, to really make sure that we have a saying, nothing about us without us. And that just means that nothing is created without really considering who is being impacted and who the services are being offered to. And so, of course, when we're thinking about families and we're offering that support, it's also important to make sure that we're a family. And just to go back, we are a family organization. We provide services to youth and families from 0 to up to 21 years old, but we also support their siblings and we support the caregivers. So we want to make sure that as we're developing plans, that we're also not just considering the individual, but we're considering the whole family in services. That's really important for us to be able to do that, and really honors everyone that's at the table. That we're being mindful of our communication, that it's free of judgment, that we're continuing to be respectful in our communication. And then, of course, we elicit feedback from families. We talked about the satisfaction surveys, but we do things called post-discharge interviews. We're doing parent and youth panels. That's actually something we hold quarterly, where we are we have families that have received services and they're offering their feedback to us, and it's panel style. And then our staff are able to, we have a number of questions already developed, and then our staff are able to also ask questions of the youth and families that have received services. And they give us really excellent feedback. And sometimes it doesn't feel so great because they're giving us the truth. And but it's opportunity for us to improve. And so we take that information, we follow up with the program directors, and then we have them, they actually fold it into their what's called OAMs, which are outcomes, activities, and measures for their program. So that feedback is really, it's not just thank you for your feedback, it's thank you for your feedback and here's what we're doing with it. And that's really important when we're honoring that family voice and choice. We also have annual parent surveys. Right now, we've been piloting collaborative documentation. And so as we are considering making sure that our documentation practices are very transparent, we are also surveying the families and the youth to see what their perception is on collaborative documentation and how do we improve it. And then we have something called therapeutic behavioral services, and we have a focus on the collaboration with caregivers. Again, honoring everyone in the family, including the person that's caring for the young person, which is particularly important because our youth don't operate in silos. So if we have services that are just working with the youth and we're not doing any skills transfer and support to the caregiver, we're missing an important link. And when a family goes into crisis and only the youth has the list of coping skills that they might be able to use in that crisis, and the parent or caregiver is not there to remind them, to give them the tools and to support them along the way, we've missed out on a critical opportunity. And so we use that focus on collaboration with caregivers to make sure that that's continuously and consistently being honored.
So honoring voice and choice in crisis, everything that Ebony just shared with you is, and these are the skills we're going to use, right? So gathering that information from our families, whether that's in a panel setting or through surveys or through post-crisis questionnaires, conversations, right? It's affirming that we are putting the client first. We are making sure it's client-centered and not system-centered or system convenience first. We want to make sure, again, active listening, validation. We're going to operate with transparency because we want to make sure that we are hearing correctly and that we are responding correctly. While some messages may be hard to digest or ease into, it's necessary if we want a successful program and a program that's really going to meet the needs of our family's voice and choice and systems. And if we choose not to listen, we continue to perpetuate systems that don't work. And I think we're seeing plenty of examples of what that looks like right now, today. Anytime you plop on the news, you see things that are not working. And I'm sure all of us are sitting at home going, oh my gosh, why don't we just do this? And the first step to just doing it is listening and honoring the voice and choice of those you are serving. Team-based. that's the next principle. And so I'm sure that when a crisis utilization team goes out, it is a team. There are some teams that are partnered with police officers and a mental health professional that go out to respond in crisis. I can tell you at our organization, if someone utilizes our on-call services and needs support after hours, we send out a team of folks. So we send out 2 people so that they can be supportive in a family setting. But it's always important to be thinking about this, of how the team is going to respond, how the team is going to go out and be supportive. I think going out in teams is helpful, just as we can help de-escalate whoever might be having a challenge, and helping the rest of the family understand maybe the steps in the process or the perspective. And also gather the information, right, from the calm person who might be in that crisis, gathering the information of how it happened, why it happened, so that you guys, so collectively a decision or process can be formulated on how to best respond. So we have team-based approach in a crisis response. So who's on the team? You know, what are their roles? What are the tasks associated with those individuals? And then being intentional, right? Being intentional about responding, being intentional about who is taking on what, and making sure communication is happening across the board and amongst the team.
Yeah, and I think one of the things that's is really important here around that being intentional about responding is if we're collaborating in a team way, that knowing what each individual's role is, what their task is. The last thing we want to do when we're going out and responding in a crisis is create more chaos, because there's no clarity on what each person's assigned role and task is going to be. And so really making sure that as you're doing that we are really being mindful about that, so that we don't cause more challenges for the family in crisis. We're there to decrease that and not increase it. So that's really important. So what we're going to do right now, we've actually covered the first 4 principles of family-centered practice principles. And so we actually have, if you don't need any more acronyms, we're going to give you one now. And it's SOFT-PIN CCC, SOFT-PIN CCC. So we've actually covered the first 4, which is strength-based, outcome-based, family voice and choice, and team-based. I'm going to put those in the chat, or Christina, if you don't mind typing those in the chat. We're actually going to go into a quick breakout. We'll only spend about 7 minutes there, and really just wanting to take a moment to reflect on the first 4 that you've heard. And if there's any characteristics, any thoughts that you've had. So this is just a quick reflection with about 4 of the folks that you're also in training with, to share if there's any things that you're going to carry forth, or anything new that you're going to do based on what you've heard so far. One of the things I really love about training is being able to make sure that I have a list of things I'm going to take away and bring back to my organization, a new practice, or something I'm going to consider more thoughtfully as I approach and support families that are in crisis, or just as I approach and support individuals in general. And so these family-centered practice principles can be used, and not just in crisis, but in all aspects of how we deliver supports and services to those that have needs. And so those practice principles, I believe, are already there in your chat. Yes, and the acronym. So you have another one. We'll cover the other ones, which is PIN CCC on the after we come back. But for right now, we're going to go ahead and go into the breakout rooms and do a reflection on anything that you think you can take back to your organizations based on the first 5 or 4 that you've learned so far. I'm going to call on my friend Jared here, because he always has something good and smart to say.
I knew it was coming. Well, I think we kind of just processed, how important those principles were. And we had 4, kind of different perspectives of why they're important, from somebody that's in, trying to make some decisions in their educational path on social work, and how important it is to recognize these principles, and how, as they move forward, they'll be used. We had like a couple seasoned veteran folks that said, this is just a part of the way we are, and the business we do, and that so the agencies already do it. I think the third thing I might mention was that there are some communities that parent partners aren't, these principles for family-based practice and family-based partnership aren't they're not as far along as we think we would like them to be. And there are some communities that are really, really far behind with these kind of this paradigm shift. And so we kind of closed out on the idea of maybe this idea of family-driven, partnership, team-based. There should be less focus necessarily with families and youth, and more on system advocacy and making sure that it's not just about parent partners doing good work and family-driven services being done, in the communities with families, but also on the agency level, on the system level, and how important those principles are to embody all the way up. So I don't know. There was like a synopsis of a bigger conversation.
Right. Yeah. Yeah, absolutely. That system advocacy is critical. Because we can do these things in organization to families or organization to individuals, but we're missing the mark if we're not doing that larger system advocacy that's needed to really shift all of the systems to have these types of approaches. So
Exactly.
Agreed. Yeah, absolutely. All right. Well, and this is good modeling for us to be able to review some of these. For those, we had a smaller breakout group for ourselves, and some of the folks in there have not yet responded to crisis, or are just newer in their systems of care and are learning. And so this is a great really good practice if you're doing these breakout groups, even within your own organization or with your leadership, to reflect on these practice principles. We're going to go back to the training for the sake of time. We won't practice this again, but to do the reflection of how many are we really truly carrying out and with families, and in a time of crisis. One of the things that I remember doing when I was providing a lot more direct work was I would actually, that soft pin CCC, or as Jared was saying, that soft pink, looking at every single one of those principles. And I would consider, am I being strength-based right now? What is my focus on their outcomes? How am I individualizing this? Who are the natural supports that need to be there? And so it almost becomes like this memorization of these principles to hold myself accountable, and almost like a fidelity measure under which I was operating, to hold me accountable to those practice principles and make sure that families are receiving the highest level of services that I could potentially offer. So thank you all. Did anyone else have anything else they wanted to share from their groups before we go back into?
Just really quickly, we
Yeah.
found in our group that being able to provide choices for families is difficult for us. We both work in more of a rural area, and so limited resources. So just trying to provide those choices, sometimes you just have to try to be really creative so that people still feel like they are part of that, even when children are taken from the home, or even though things can be really tough right now. So that's just a challenge that we found that we had in common with that.
Yeah, thank you for sharing that, because definitely rural communities do have their own set of strengths, but then also challenges in navigating what resources are available, how small the town is, and then how to make sure families have that access when there's not a lot of options for them to access. So thank you for highlighting that. It is definitely something that needs to be considered. All right, we talked about that team-based approach in crisis response. So I'll pass it back to Christina for persistence.
This is probably my favorite principle, is persistence, because it is one, right, when our families are feeling hopeless or they're feeling at the end of their rope, that we get to kind of bring this revitalized energy to the situation. And so that first bullet point, unconditional acceptance and regard, is highly crucial. And so this means we're not judging them as we're walking into these situations, but we're really walking in with openness. We're really walking in with unconditional acceptance. That is what it is, unconditional. So it's not set on, well, I don't feel comfortable with this. It's not about you and yourself. It's about how do we really walk in and support the family and doing whatever it takes. So down here, I know that some of you have talked about child and family team meetings. I know that you guys have talked about, like, in those meetings where you're talking about the strengths and you're talking about concerns, persistence is taking all of that information and maybe inspiring hope where there is no hope. highlighting those strengths is a good hope initiator. And so being persistent is going to help our families continue to move through their challenges and feel empowered to make different decisions or maybe see the light where they couldn't see it before.
I definitely love this one as well. I think back to when, my now 28-year-old daughter was 13, and whenever she was frustrated, she would run, and that was a crisis for us. So she would take off. We wouldn't know where she was at. We were, having to call, make reports. We were it just felt like we were just completely overwhelmed, and we didn't know how to keep her safe. And having team members that were persistent, that continued to follow up with us, to go back to the drawing board, to throw out new innovative strategies with us. Even when I was going, I don't think that'll work, they'd say, let's just give it a try. And I was in there, I was willing to try anything. But the team that continued to stay persistent was what kind of held me in those moments of crisis, and really fear of the unknown, fear of her getting exploited, fear of all of the different things that could happen when your child is not safe in the home with you. And so it really is so important for us to honor that persistence, and be mindful of making sure that if we're feeling particularly frustrated, we lean back on the previous character principle, which is team-based, because the team can also help rally when one person is maybe feeling like, how are we going to continue to support this family when they're constantly in crisis? That team-based approach can really be helpful too.
So here we have persistence in crisis, right? Exploring and reframing. That's what we want to do for the family or the individual who's experiencing crisis. I think another important part is this list we have down here below, which are pain-based behaviors. When being persistent, it can feel like we're hitting roadblocks when we're running into behaviors such as impulsive outbursts, aggression, right? Self-injury. We have to be persistent. These behaviors wouldn't exist if pain wasn't present. And so we are part of crisis response teams. That's our job. Our job is to respond when the light goes out in the room. We bring the light. And so by bringing the light, we can really look at pain-based behaviors differently. This is going to help us make different plans in order to be persistent for families, really hear them out, really highlight their strengths, and maybe reframe it for whomever is a part of that crisis response, right? Whether it's on your team professionally or for that family who's there as a natural support for that individual.
Yeah, we've got to help them recognize it. And so Christina is probably going to roll her eyes because I say name entertainment all the time. But helping even the natural support system understand that trauma lens and what pain-based behaviors can look like when they see that running away, right? With my own kiddo, she lost her father to suicide. And so when she was running away, that was a pain-based behavior. This was a response to the trauma that she had experienced. And so, but I saw it as she was running away from me, right? I didn't look at it as a pain-based behavior, but having that reframed from me and having to be able to understand that I was able to operate from a trauma lens and then be able to support her differently when she returned back and welcome her with open arms instead of going, oh, why did you do this again? I would say, I'm so sorry that you're experiencing this type of pain. And this is how you can feel safe, is by taking off and taking a break. And so being able to reframe that for even the natural support systems, the caregivers, so that they have an understanding as well.
Fix is individualized, and it's just that we are offering every family, every individual we are responding to their own plan. So we're not using the same plan across the board, but we are really looking at what works for that individual, what works for that family. For example, I worked with a family one time, and deep breathing was a common intervention for most of the kids at the time, right? They'll recognize when they're not coping well, and they're going to use deep breathing as a coping mechanism. And the family was triggered every time someone said deep breathing. And so it was really important that in every intervention and every approach for this family, that we didn't say deep breathing, because you were going to get a very adverse response of that ish doesn't work. And so give me something else, because that space is not available in my house. And so making sure that whenever we are coming up with a plan or a supportive technique for a family, that we're really listening and it's being individualized. So here's how we can do it in response to a crisis. We consider baseline behavior. So baseline behavior is pre-crisis behavior. This is why having a team approach in a crisis response is helpful, because you can find out, okay, we're at a crisis, and what does it look like when this kid or this family member isn't in crisis? How do we get from A to B? Recognize the different strengths and abilities, understanding trauma. Like, that's why we're also responding in these crisis situations, is more than likely trauma is at hand. And we have to be able to make sure whatever responses we are providing is considering those factors through that trauma lens, because you don't want to accidentally set something in motion that is going to re-trigger or re-traumatize that family or that individual you're responding to. And then at the bottom right, self-regulation, co-regulation skills, self-regulation, giving that individual those skills to respond in a way that feels good for them, that is really going to work. And then helping the family sometimes help that individual if they cannot help themselves. So help me help myself is a term we often use when we're talking about crisis management through another training we utilize.
One of the things I appreciate so much about a natural support system is, one, that studies show that the stronger a person's network is, the more supported they are, the less what we call recidivism. So coming back into services, either child welfare system or even juvenile justice system or even the mental health system. And so it really is important for us to focus on actively seeking out and engaging that network. And so even when we're thinking about crisis response, when a family is not in crisis, how are we engaging their support system so they know who to call as they're along that kind of crisis, the crisis stress model? So what does that look like at baseline? Hey, I'm starting to feel maybe pre-crisis, I'm starting to feel a little anxious, I'm starting to get a little irritated, and I'm able to now say, I think it's best that I give a call to my best friend or my cousin or my mom or my grandfather, and because I know this network of people is there to be able to support me when I know I might be heading into what feels like a crisis. And so it's important for us to make sure that network is really strong, and consider what are the activities and interventions that really draw out natural supports to contribute to that overall treatment and service plan. And so we are so grateful at our organization to be able to think about we've done like family, like coffee mornings, things on the weekends where we're saying, hey, we're going to provide a little bit of, meals, and bring out any and all of your people that you enjoy spending time with and then can support you. And then we're able to network and talk about what supports look like in the future for that young person. And so that's why I find it just really important, because we know those natural supports are there before the crisis, and then they often can be there during and then after our services end. So when we're looking at long-term self-efficacy of an individual, we know, again, studies show a natural support system will prevent them from experiencing crisis in a way that feels really isolating. It's not saying that it's going to prevent the crisis from happening altogether, but it's better managed when you know that there are loving supports there that will walk alongside you as you're experiencing it.
We're not meant to be in our families and individuals' life forever. And so natural supports are critical for the longevity of the family. I don't want to be the answer to every crisis situation. I really, really want families to feel solid, fortified, empowered to respond to whatever they may be facing. It's not normal to have professionals come in and direct you and tell you what to do. I think we've normalized that in some of our practices, and we really got to get back to having families feel like they got this and that they can be supportive to whomever is needing support at that moment.
Yeah, I agree with that, Christina. And surely after our calls back with families after they've experienced a crisis and called, one of the first things we're doing is having a meeting with them, a team meeting with them after crisis has been averted, and talking about what does it look like the next time this happens for you, and who are the people that you can call. We want to be there and we want to be able to offer that support, but we really want to create a community where there's interdependence on the natural support systems and the community resources that are there, so that you don't have always professional responders. So when we're looking at natural supports in crisis response, there is so many opportunities to do some coaching and modeling for our families. And so you'll see this kind of here, this model of encouraging positive relationships and building healthy attachments. So really taking a look at the individual and seeing, is there a need to increase their current relationships and healthy attachments? Based on some of the families that we've worked with, over time, sometimes they've lost relationships because of situations and experiences. And so I think one of the biggest legacies we can leave is, how do we help them rebuild that in a healthy way, or create new relationships in very healthy ways? And so how do we help them to build those healthy attachments? And then of course, modeling and teaching them soft skills, the natural support person to the young person, and then of course helping them, the natural supports, to be aware and emotionally supportive. I think of myself as a natural support for my now adult daughter, and of course, if she still at times can have struggles, I know how to be emotionally supportive to her based on how I was coached and mentored through my teams and some of the learning journey that I've been on. And so making sure, of course, again, that next part of this cycle is that the natural supports know their own personal triggers. So I know this is a good example, just recently, when my daughter makes a very silly money mistake that I'm like, haven't we talked about this all the time, right? But of course, it spins her into feeling anxious because she now has to worry about how she's going to manage financially, but it's also a trigger for me. So I know what my own personal triggers are related to that, and I know how to check myself and then maybe draw in another natural support that can help her manage this instead of me, because I may not be the right person to respond. And that's important to support our natural supports in knowing, am I the right person in this moment to respond to my family member, or is there someone else that we can call on? And that's why it's important for them to have that large network. And then it's important for families to understand what the stress model of crisis is. What does a baseline look like for them? And then what does it look like when they're maybe in an agitated state? And what are the things you can do in each moment of that stress model of crisis? So then when they're in crisis, maybe it's, I know to give them space. I know to give them space, but also communicate verbally that I'm right here and I'm here if you need me. I know that they don't like touch when they're in a crisis, so I'm not going to touch them. Or I'm going to say, let me know when you're ready for a hug. And all of these things are really important for that system that is being developed to know about the person, so that they can in kind respond in a very through a trauma lens, and that they're being culturally responsive as well.
We had a question in the chat.
Yeah.
From Noah. It says, from your experience in a system with extensive family support, such as family peer specialists, advisory boards, or similar structures for engagement, does the system become more isolated for those without family support?
Are you asking, do you think that the system kind of contributes to isolation because they don't have the family support, so we're all coming in and stepping in as those?
No, it's more to say that, because we now have so many, and I don't want to disparage these systems, certainly, but
Yeah.
When we build into a lot of supports and engagement opportunities and things for family in the system, it seems that, now somebody without family becomes further isolative because they become more aware that all of these extensive supports are available for something that they lack. I'm just kind of curious if that's been viewed, because it just kind of popped into the back of my mind.
I think that can happen. We have experienced where families don't have a lot of family support, and so they rely on system providers a bit more, and it causes them to maybe go a little bit more inside, become a little bit more hardened to the conversation around natural supports. And this is where it's really, really, really important that anytime we are approaching any kind of conversations, and maybe we're linking them to community support groups with families that are experiencing similar things, or activity groups for kids, right, who have experienced a loss, but that we're also hoping and providing them with resources to help them maybe relax and see the commonality that they have with other folks so that we can start rebuilding what that community looks like. It looks different per situation. For our kids that are in foster care, we do family finding, especially for those situations where those kids can feel more isolated, and that's a little bit different.
And what we don't want our system to be, our supports to be something that doesn't create the interdependence in their communities. And so that's why this is one of the practice principles and one of the most important ones is so that while we can offer all of these supports, we want to then follow up and say, and who's going to replace me? How are we going to make sure that, and being a part of advisory boards are something that they can continue to do while also maintaining a very healthy natural support system. And so I think both can coexist, but being mindful that the family support system should be first. But I think that's a great question, Noah. Yes, and agreed with your Noah put in the chat again. I suppose this could be a component of other peer-driven efforts to wrap around folks without family to create a pseudo-family-like support system. And it can with advisory boards, because we have a number of folks on our advisory boards and on our shared leadership, and they exchange information and they all support each other, and it's completely offline from us. Even we have the even our support groups where we had a family member that went into the hospital, and all of the youth that were at the group had exchanged information, and all the parents at the group exchanged information, and they were all without us had created this support system amongst each other. And that's exactly what we hope for. And though we know those relationships will continue to exist long after we're gone.
Here we have community-based principle. And so community-based, we were just talking about community and building community and utilizing the community. So planning services in community where families live. I know that can be difficult when we're talking about rural communities and the lack of resources. But there are ways, right? If it's creating a small support group, or if it's about connecting play groups, right? There are ways that we can utilize community-based approaches and supports to support families when they are in the middle of a crisis or post-crisis. Community-based it can be inclusive to whatever that family's needs are, whether it's a cultural response, a community-based approach, right? So we know that there are different communities out there, and maybe there's a way in which they see crisis or trauma, and being transplanted to a community that doesn't understand your struggles or challenges is going to be difficult, right, to get that same kind of approach and loving response. So being mindful of what community-based can look like for our families and individuals is important, and linking them to the appropriate resources that meet their needs.
So when you're just looking at connection to community and how important that is, and this goes back to like that natural support system, and now the community support system, right, is the next area that we want to make sure that families are linked to. First, considering what's internal that we're offering, but then what's external, identify the resources that can support with the ongoing recovery needs, and then who do we partner with? I think it's important for us to know where those partnerships are and exist, and create those if you don't already have them already within your communities, so that you kind of almost have a list of, here are the go-to options for the families. I know that may look different for the rural communities that someone mentioned earlier, but even within that rural community, developing a strong kind of infrastructure and network of community-based resources, and being able to thoughtfully explain that to families as to how they can support them, and having that partnership will allow you to be able to do that when you know the organization a little better and know what resources they can offer. And so collaboration, very closely connected to team-based. So I won't spend a lot of time here, but just really want to emphasize how important that collaboration is with the family, linking back to family voice and choice, making sure that the entire team is really sharing the responsibility for developing and implementing and monitoring and evaluating whatever plan is in place, be that the treatment response plan, the treatment plan, or the crisis response plan, the family service plan if it's child welfare. And so just really considering and making sure that everyone is a part of that collaborative process of that development and implementation. That each plan is really blends every team member's perspectives. So you're really not just looking at what the family is absolutely leading that process, but then you're also leaning on some of the valuable team experts. Maybe it's the clinician that can offer this area, and the psychiatrist can offer information if there's med management that's important. So just really leaning on every team member's perspective so that it's a real strong collaborative process. And then, of course, as we're considering being culturally responsive, which you have heard me say probably from the beginning of our time, and just how important that is, that making sure that as we're developing these crisis response plans, when we're responding in crisis, that all of the services and the planning that we're doing are grounded in the family's culture, values, and norms, and not ours. And so I say it again, it is in the family's culture, values, and norms, and not ours. And sometimes that means that we are checking bias at the door, that we are learning about the family's culture. And in earlier slides, we talked about ways that we learn more about the families. One of those ways is our what we call strengths, needs, and cultural discovery. And so we're helping the family explore, and it's a living, breathing document, what they value about their home environment, what they value about education, how they've previously responded in crisis, and what they need now. And so one of the things that, one of the practices we had to review within our organization is every safety plan always had call 911. And it was almost like this cookie cutter. It wasn't very individualized. It was almost like a add it to the bottom of everyone. There were still individual characteristics of the safety plan, but at the end, in doubt, just call 911. And for some families, that's just not their reality. That's just not something they would do. That's very, very similar to my own family's culture. Because of our concerns with having contact with law enforcement, speaking from personal experience, we would not call 911 in a crisis. I would call my uncle, I would call my cousins, I would call my family members. And so having that on there as an option would be something that I want to make sure that I wouldn't want, because I want to make sure that we have that. And so just really being mindful that as you all are thinking about that, you're educating yourselves about the unique culture of that family. You're also educating yourself on, if at all possible, and they're willing to share maybe some of the trauma with systems that they might have experienced. So you have an idea of that. So that as you're talking about crisis planning, you're doing so in a way that's responsive to their own individual needs and their past experiences. And so I've shared some of that already, so I won't repeat this, but just having that knowledge of historical trauma is important. Understanding the cultural and ethnic differences as it relates to crisis. I saw in the chat, Eliana mentioned that we started out including the LGBTQ families as an example with Chosen Family, and also another intersection in cultural responsivity and what their experiences are with crisis responders, especially because we know that the transgender community has experienced quite a bit of trauma response from different crisis responders, law enforcement. And so particularly communities that have communities of color, LGBT community that have not had good response systems or have not good experiences with response systems, we have to be really mindful of that and ask them about those past experiences and what they need in the future.
And I think I would add, just like adding questions as you're developing those plans about how to respond in a crisis. Who are we going to call? And what are they going to do? And do you think any additional support is going to be needed for that person? Are we calling your auntie, and then auntie's bringing over uncle, and uncle's bringing over cousin to help with, the youth who's blown out, and they're really close. So really asking, digging in, so that the family is thinking about things that maybe they didn't conceptualize before.
And so we ask ourselves, what does it look like when using family-centered practice principles? And we're going to end here and move towards any last questions that you all have. But these are some of the ways we've kind of shifted our perception through the years, and just offering support to families. And this is just one really small example, but some of the things we still sometimes hear with new folks are coming on board with us, and I'm walking, well, now more so not walking in the buildings, but walking virtually along with new folks as they're acclimating to our culture, and our recovery culture and culture of support and our family-driven care culture, that, this family won't take the steps to improve or recover, or they can't take the steps. And so just helping folks reframe that, pushing past labels, sharing what we can do. So if they say they won't, we say the family needs us to provide some support, motivation, permission, safety. And then if they say they can't, the family needs some support with knowledge, skills, and resources and capacity. And so just really being mindful that language does matter. And so it says here, it's sometimes hard for team members to fully agree with a plan. And this helps with collaboration and the team-based approach. And so this is something that I call gradients of agreement. And it allows all of us to honor each team member's perspectives and sometimes their reservations, but still be able to move a plan forward. And so, those gradients of agreement can go from, this is just a really small one, but there is one that has like 10 on it. And so you can even say from a scale of 1 to 10, where are you at? And then if they say I'm a 5, well, why are you at a 5? What would get you to an 8? And that helps to elicit discussion from the family around what next steps can be taken to support them more and helps to honor their voice. We've got 5 minutes left, so just want to see if there are any questions from you all and hopefully be able to answer those with our last few minutes.
No, I love this piece because the family kind of model, at least in behavioral health, has been discussed, I think, a lot less than the peer-driven models themselves. So I think, to me, this really adds that additional layer, and it's got my wheels turning, especially around like that chosen family kind of component to integrate with the sort of natural or biological families, so to speak. And this notion to link in folks that are family-less into these structures to give them that sort of family. I'm really digging this. This has got my wheels going.
That's great. Thank you.
I love hearing that. Yeah, there are some people, I just think about my circle and chosen family. There are folks that I love my sister, my biological sister. However, I would probably not trust her in a heightened crisis situation. And so knowing like, oh, I can rely on my friend, right, who's more like a sister in some ways and understands like the depth and things I haven't talked about my sister, relying on them to be supportive would be helpful. So really that chosen family is important. Here we have a question.
Yeah. So, okay. Yeah, we use the strengths needs cultural discovery that I mentioned, MB, that to for youth 0 to 12th grade and beyond, really, because we are asking them. We're not just. It's more of a just. It's not a question and response. I think when we're looking at exploring strengths with families, we really have to kind of be detectives and sometimes find things that are not being said too. And so while we have documents that can ask those questions, sometimes we're identifying what we would call functional strengths in the moment with the families based on how well they're functioning or what they're doing to manage something that's really hard for them. And that's a strength. And so we're helping them to identify in those ways as well. But the strengths needs cultural discovery is something we're happy to share and maybe can send out with the evaluations if that's okay with the CARS team.
First, before we do anything else, thank you, Ebony, Christina. This was brilliant. I am watching people in the chat box talking about how important this learning was. And I am absolutely certain that if people have the time to take our evaluation, our audience evaluation form, the link for which will be placed in the chat box, that we will hear from everyone as well, that the learning that you shared was really impactful. And as Noah said, is making our wheels turn and having people think in new ways completely. So thank you so much, Christina and Ebony. And finally, we hope you'll stay in contact with us. Please visit us on our website where you can place a TA request if you have additional questions that you'd like us to do follow-up training and technical assistance regarding. We also invite you to connect with us in social media and to join our CARE newsletter.